Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, should the state of Pennsylvania implement the Affordable Health Care Act? Oh, that's a national health care law. And guess what? The other side of the tuition tax credit voucher issue, should vouchers be used in this state? That and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
All right, welcome back to the program. Well, the host sort of botched that thing. We're talking about vouchers, not tax credits. Matthew Brouillette from the Commonwealth Foundation. We're getting both sides of that issue. And I forgot to say, Pennsylvania politics in depth and in detail. And guess what? It all starts right now. What's the host now? All right, joining me as often is the case is Gene Barr from the Pennsylvania Chamber. He's a VP there, and Jim Redmond. He's another. We have a lot of vice presidents, Hospital and Healthsystem Association. All right, Gene Barr, I'm going to start with you. Wow, big change in Harrisburg, cultural change. Republicans, both chambers, you guys are hanging around that legislature doing your job. How do you describe all of this?
Well, you know, it's interesting. A lot of people saw the bit of a dust-up that was in the House meeting the other day. Some of that's to be expected as you make those kinds of changes. Each side's kind of, I think, feeling each other out. And not to mention, we got a new administration that's still filling seats, still filling spots, and getting ready for the budget address coming up.
And that's a huge deal. I mean, probably it's all about March 8th, correct?
That's the big date. That's when the budget comes out.
Yeah. I mean, we've heard nothing to this point. No, you know, if this were a Rendell administration, we'd already know everything in it, right, Jim?
Yeah. He still gets more press than our current governor, I guess.
Yeah, he does. Well, he signed about 7 more gigs. I mean, he gets a job offer a day, it seems.
Well, here's what we do know. We face somewhere around a $4 billion revenue shortfall. The governor has said that he's not going to raise taxes or fees.
Right.
That means he's got to cut or sell state assets in order to balance the budget. And we also know that they're not going to go beyond the June 30th deadline. Yeah. And that we're likely to see actually an early budget rather than a late budget, as we have in the last 8 years.
All right, I want to do 2 things with you folks. I want to talk about legal reform, and the other thing I want to talk about is this Affordable Care Act. Now, look. And I think you guys have some disagreements on it. Good, I won't get you in a big fight here. Gene Barr, I'm starting with you. The Affordable Health Care, now we've had 4 decisions on it. You know, I'm talking about the National Health Care. 2 say it's unconstitutional, 2 say it's not. This Governor Corbett was party to the Florida case, the more recent case in which was ruled unconstitutional. The mandate, you know, everybody has to have coverage by it. What's your position on this?
It's clear as headed for the U.S. Supreme Court. I mean, that's where the final decision here is going to be made. We believe, from our perspective, there are some real fundamental flaws in what was done. As we've said many times, there was no real work done on reducing the cost of health care. And we're going to talk in a minute about one thing we think ought to be part of that, which is legal reform.
Which you two do agree on.
Absolutely. There was nothing really done on that. There was real concern over the individual mandate, over the cost to businesses. In fact, they're already changing one of the pieces, which is this 1099 requirement. They're already working to change that, which is going to take dollars out of the system. They relied on some of the dollars from fines to fund some of the affordable health care. So they're already making changes on it.
Okay. Now, your position is that the health care law passed March of last year, I think, should go into effect in this state at this time. Is that correct?
Yeah, until the Supreme Court decides. Now, we also saw the House of Representatives repeal it, but the Senate decided not to. So we still have a lot of uncertainty. Certainly, we have controversy over this particular law, and we're going to see controversy for some time.
All right. Now, an interesting position here, Gene Barr, of the governor. He was part of the Florida lawsuit, 26 states, I think, in which he said this is unconstitutional, it should be thrown out. Several states, Florida included, since that decision has said we're not going to enforce the law, the mandate part within our state, or maybe all of it, any aspect of it, but certainly the insurance exchanges and the mandate. Now, Governor Corbett has said we're going to do that.
Right.
And you would say, no, don't do it.
Well, what we'd say is you need to look very carefully at what the impact is going to be. Look, we've already said this is going to the U.S. Supreme Court. As Jim said, the U.S. House of Reps voted to repeal the thing. It's not going anywhere in the Senate. This is going to come down to a court decision. Individual governors are going to have to make a decision about what they believe is best. Governor Corbett, as AG, had serious problems with this and joined that action. I think they've got so many things on the plate. This, unfortunately, falls down the list a little bit.
Before we go to break, and then I want to talk about this legal reform situation, but look, both of you represent some of the largest employers in the state. You with the business community, you with the hospitals. I mean, what's going on in terms of the unsettled environment now with, I mean, this has to be just...
Well, there are two large groups that have great responsibility for implementation of this law. The insurance companies, which have got to make a lot of changes to the way in which they do business, as well as our hospitals in terms of implementing many of the delivery changes that are in the Affordable Care Act.
Right.
That takes time and it takes resources, and the uncertainty around this creates problems in terms of implementing. Now, like the insurance exchange, I would argue that's a good thing. Why not have the ability to go on the internet and have access to information about how you can purchase various health care plans?
And across state lines.
Right.
And you would
Absolutely,
agree.
absolutely.
All right, well, I got you to disagree, but you did it too nicely. All right, when we come back...
Okay, we'll make up for that later.
Make up for it. No, you're going to agree on legal reform. It's on everybody's mind. It's a part. Governor Corbett is for legal reform. Yep. We're going to talk about what that means and why it's good or bad following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. Gene Barr and Jim Redmond are here. We're talking about a number of things that are pretty important in health care. I want to talk to legal reform. Jim, let me start with you on this. Legal reform, first of all, when you hear this term, tort reform, legal reform, what is it that means so that our viewers have a sense about that?
Well, it's the legal climate here in Pennsylvania, and particularly as it compares to other states. Pennsylvania has one of the worst legal climates of any state in the nation. In other words, more people sue businesses and individuals than in other states because of our laws. And we, along with the business community, believe that those laws ought to be changed and at least be similar to what is occurring in other states.
Mm-hmm. And so what you, Gene Barr, what you folks would argue is that that the way the legal system works is it penalizes unnecessarily folks who may be involved have some liability for an event or an occurrence, but not the complete liability, and that's one aspect of it that's a problem. Talk about that.
And sometimes maybe not even have liability, because what happens is, because we haven't reformed something called joint and several, in which one person might be 1 or 2% or maybe even suspected, could wind up paying 100%. So they sue, they settle to get out of that case. The reality is our lack of legal reform has hurt access to health care, has hurt job creation, and directly hits the consumer, and we've got innumerable examples of that. In fact, to go beyond what Jim said, he's absolutely right, we consistently rank near the bottom in terms of our legal climate on various counts. Philadelphia was recently named in a national study as what they call the #1 judicial hellhole in the United States. And that is not a #1 ranking you want.
And we're not talking about the abortion clinic doctor either.
We didn't
even go.
That's right.
All right, walk us through this. Okay, you got a legal case, and somebody feels that they have a medical there was some medical malpractice, and a doctor, a hospital, other people might get sued. What goes on that you are particularly concerned about?
The strategy on the part of the plaintiff attorney is to get as many individuals involved in a lawsuit
with potential liability,
right? And to try to make sure, particularly those that have large assets or are well insured, and then try to work out some sort of settlement. And the concern on the part of many defendants is the uncertainty of what happens at a jury trial level, particularly where there's a lot of emotion involved.
All right, good point. Now, let's go to what could happen here in this state. Governor Corbett has said he is for reforms.
That's correct.
Give us an update. Where does this stand in our state?
We need broad-based reforms, Joint and several leading it, but so many other things across the board. Protections for innocent sellers, statute of repose, apology for doctors and hospitals, a whole bunch of things. You're right. Governor Corbett on the campaign trail said he supported this. House Republican caucus and many Democrats support this. Senate Republicans, a lot of support there.
Is it doing anything in the Pennsylvania legislature?
At this
as we
point,
speak?
bills have been introduced. Things are moving forward. It's one of those things, look, it's the beginning of a session, the beginning of a new administration. We all know things have to take a little while to get moving.
They got to do the budget. The budget will be the priority.
Because I think there is widespread recognition among a lot of people. We just sent a letter across to the legislature asking for broad-based legal reform from almost 50 different statewide associations, local governments, business, doctors, hospitals, all across the board. It's a big issue.
Before I let you go, now we're down this road with Governor Rendell, who vetoed a piece of legislation. Now, he argues there were some changes in it from what he had talked about when he ran for office. You more optimistic right now,
well,
like Gene
the bill
is?
that passed in 2006, which he vetoed, was the same bill that passed in 2002 and signed into law by Governor Schweikert.
Mm-hmm.
That law was challenged not on the substance, but on the way in which the legislature passed it. It violated the so-called single subject rule. So the bill that has been introduced in the House, House Bill 1 by Representative Kurt Schroeder, the bill that has been introduced in the Senate by Senator Jay Corman, Senate Bill 2, is the same bill that passed twice before.
So both of you, if you had a bet, if you were betting men, and you would say this is likely to pass it.
Certainly joint and several, and we certainly hope a broader package as well. We are so far behind other states. We need a broad package of bills.
So in these, but you don't expect it. It's not going to be out of the box. We'll have to wait to see if it's in Governor Corbett's budget message on March 8th. I mean, it's likely to be there, and how much of a priority it is, right?
Right.
All right. When we come back, Matt Brouillette from the Commonwealth Foundation is here. Recently, we just had Tom Gensel from the school boards. We're going back and forth on school choice. Is it a good idea? Isn't it a good choice? I'll have Matt explain what the facts of it are, and then we'll let him get into his interpretation. School choice, you're talking about tort reform, add school choice to the mix, sell the liquor stores. We got a lot of change in the offing here in Pennsylvania, and we're going to change newsmakers. We're going to go pay our bills.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, as I said at the break, you know, we're doing the pros and the cons of school choice. It's a huge issue. Governor Corbett is for it. Governor Rendell, talked a little bit about charter schools, not so wowed about school choice. All right, Matt, let's start with the fundamental here. Matt Brouillette, he's the president and CEO of the Commonwealth Foundation, a Harrisburg-based think tank. Let's talk a little bit about what is in the proposal that has currently been introduced in the state Senate.
Sure.
What is the school choice legislation?
Senate Bill 1, which certainly signifies the importance that
Correct.
the Senate has placed on this legislation, would provide school choice for a lot of families in Pennsylvania. It's sort of a two-pronged approach. One side is an expansion of an already existing program, the Educational Improvement Tax Credit Program, that provides scholarships to families that can go up to $50,000 in a household and $10,000 for every child. So a family of four qualifies at $70,000 per household. Today, about 40,000 kids are using scholarships to escape underperforming public schools and are attending
so
private
they could
schools.
take that money and go to any public or private school in
That's
the
correct.
state or within a given region?
Correct. That's
Anywhere
correct.
in the state?
That's correct.
Okay.
And it's money that is generated by corporations contributing to a scholarship organization. It's money they would contribute to Harrisburg. They only get a 75 to 90% credit for that money.
Tax credit.
That's correct. So it does cost them money to do this, but it's a way that's giving kids really an escape ticket from schools that aren't serving their needs well.
That's now.
That's correct. Senate Bill 1 would expand that. It would increase the amount of money, almost doubling it, from $40 million today to $75 million. It would also increase the access for more families in Pennsylvania. So take my family. I've got 4 children. We would qualify at $108,000. So it's really going to expand opportunities for a lot more families in Pennsylvania.
Now, in order to be eligible, there are income limits, as you point out, and then you would have to be, at the moment, in a low-performing school, not school district. That will be expanded, if I understand the author
No,
of the
that's not
bill.
for the educational improvement tax credit
I'm
component.
talking about the school choice.
That's right. The
Right.
voucher side, which is the other piece of Senate Bill 1, applies to low-income families that are trapped in chronically underperforming public schools. And those are identified as the bottom 5% of our schools in their performance on reading and math.
That's the school itself,
The
not
school
the
itself.
district.
Correct.
Okay, go ahead.
There are 144 schools that fall into that category today in 23 districts. So out of 500 districts, we're talking 23 districts and 144 schools. So we're talking about a few thousand kids that would end up qualifying.
And they can take that money and go to public or private anywhere in the state.
That's correct. And the amount of money is based upon how much the state contributes to the education of the child in a school district. Take, for example, Harrisburg. We spend over $17,700 per child in the Harrisburg School District. The voucher that they would be available for would be about $7,000. So the remaining $10,000 stays in the school district itself. It's the local money, the federal money, and that child then can take that $7,000 voucher to their school of choice. It could be another public school that would be willing to accept them, or a private school. And all across Pennsylvania, parochial schools on average are charging from $3,500 at the elementary level to $6,500 on average for high school education. So this is an amount of money that would suffice to be able to pay for the education of low-income families.
All right, and then if successful, then Senator Piccola, State Senator Piccola, he's been a guest on this program many times, he would take the expand it to include, to use a school district metric instead of an individual school metric. Am I right about that?
Well, it's going to be phased in over a 3-year period. The first year would be low-income families in these underperforming public schools. Then it would, year 2, it would expand to families that are already choosing private education. So it would increase the amount of money. And then it would go statewide in year 3 that any family that qualifies for free and reduced lunch, which is 130% of poverty, which is about $28,000 for a family of 4. So we're talking about the lowest of the low income.
All right, we're going to go to a break. When I come back, I want to talk with you about when Tom Gensel is the executive director of the school board. You guys living together, debating? I mean, you're having...
Very soon, I'm sure it will.
You're going around and debating. Well, I mean, it's a good thing to get both of you. I mean, 2 different points of view, you know, to debate this back and forth, and let's see what the folks say. All right, we're going to look at the pros and the cons of this. I think we're going to look at the pros today a little more than the cons. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, we're back with Matt Brouillette. We're doing both sides of the school choice issue. All right, let's go through, in a couple minutes that we have left, let's go through some of the criticism. We'll let you respond to them. Criticism 1, it will take money away from the public schools.
Well, first of all, remember, this money doesn't belong to the public schools. It is money that the taxpayers contribute for the education of a child. So we ought to be most concerned about the children that are not receiving an education when we are paying upwards of $19,500 in the Pittsburgh School District. And all this is saying is, let's give those children a portion of that amount of money so that they can find a better or safer school in some cases. And so this is saying we're going to fund the education of children, not systems. And that's what we have to make sure that when we are spending $26 billion a year, over $13,000 on average per child, which is more than 39 other states, let's make sure we're getting a return on that investment. And I think by many accounts, we have a lot of schools that are failing kids.
One of the arguments is that what this will do is, however, let's assume we're talking about $75 million for the just for this argument, that will come out of the regular appropriation of the school, and so that will penalize public schools.
Well, as it should. That money should come out of there. But remember, that equates to 0.3% of all public school funding. $75 million out of a $26 billion budget. When you add in the voucher component of $25 million in the first year, we're talking about 0.5%. So 99.5% of the money stays in the public school system. But again, let's not focus on systems. Let's focus on educating children. And right now, we have a lot of kids that are not receiving an education. Remember, we had this debate 15 years ago. Tom Ridge said, let's provide low-income kids vouchers. Well, the PSEA and PSBA said, no, all we need is more money, more time, and we will fix these problems. Here we are today, a generation of kids lost once again, and we're having the same discussion. How do we rescue these kids? This is one educational lifeline being thrown to kids.
Now, do you think this will be, I mean, do you think as this plays itself out that a lot of the, poor kids, let's say, in urban areas especially, won't, for lots of reasons, be able to take advantage of the program, and so the argument on the one hand is, well, maybe you weaken the public schools and then you weaken further those who remain because for lots of different reasons they can't avail themselves of this opportunity. They can't do it for transportation reasons.
Well, yeah, transportation is really not an issue. It would apply just like it does for private schools today that would be in a 10-mile radius. And transportation is really one of those low hurdles that you'd have to get over. Now, let's remember, who is going to be making choices? It's going to be the kids that are struggling, not the ones that are doing well.
I'm going to get you and Tom Gensel on here together maybe before this vote. We don't expect a vote anytime soon. It's going to probably be in the late spring, maybe, at the earliest.
The Senate will very soon, but the House will take it up later.
All right, he's in my ear. We're out of here.
Right.
Thanks for coming on. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.